Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews, here in the studio today with Maynard Nexon healthcare attorney Matthew Roberts. Matthew, good to be with you in 2024.
Good to see you.
And I'm excited to have an in-person guest with us today.
Our first of the year.
That's right, our first of the year in-person guest, healthcare advocate and entrepreneur, Kim Smith. Kim, welcome for being with us today.
Thank you so much.
Now, after 18 years in the healthcare field, you founded Health Evolve Technologies with the goal of closing the gap on healthcare inequities after experiencing HELP syndrome. And that is a life-threatening, hypertensive complication of pregnancy, and it had a significant impact on you and many women. Start us off by sharing a little bit about your personal journey and then how we got here today.
Absolutely. So first, thank you for having me. It's been an amazing journey, to be honest. And when I initially decided to go into healthcare, I did so because of the connection and the impact of healthcare on my family, right? I am a public health nerd by trade, studied rural health in South Carolina. So I was really gung-ho on making an impact. What I didn't quite appreciate was transitioning from rounding on patients with administrators with the clipboards, doing the Joint Commission walkthroughs, and then becoming that patient in the bed myself at 29 years old. So at that age, I was pregnant with our first daughter, Lauren Kelly, and we were so excited, just like everyone else. We had a gender reveal party. People came in from Georgia and North Carolina to South Carolina to celebrate with us. We found out we were having a girl, and 2 weeks later, I was leaving rural South Carolina and just had this unbelievable pain in the upper right side of my belly. Didn't know what it was, just knew that I literally couldn't hardly move. We called the physician on call, and, our options are always either wait for the appointment or come in, right? Go into the ER. My husband flew me over to Lexington Medical Center. And they saved my life. I was diagnosed with HELP syndrome. Unfortunately, Lauren did not make it. I was about 5.5 months pregnant at the time. And it's a very rare hypertensive disorder of pregnancy, which I didn't fully appreciate. It's often associated with preeclampsia or eclampsia and happens in 4 out of 1,000 pregnancies. So very, very rare. But unfortunately, she did not make it, and I had to deliver, and then they had to take care of me. So I spent about a week in the hospital. So grateful for the care team, so grateful for the experience, to be honest. I went on to have 3 healthy boys after that, but I recognize as a healthcare administrator, as someone that helped to grow medical groups for both for-profit and academic centers, that the care delivery model still, it wasn't satisfactory to me. How we deliver care today, it was not satisfactory. And the big reason for me launching Health Evolve was because the stats haven't improved, right? We still have really concerning health stats, not just with mortality, but morbidity. The breadcrumbs of after having a complicated pregnancy, it's what you might deal with later in life, when you're 50, 60 years old, from what happened when you were 29 or 30. And most people don't understand that fully. So we launched Health Evolve. I took a leap. Thankful for my accountant husband who said, okay, go do it. And we're committed to closing the gap on health disparities. We're starting focusing on maternal health because that's such a view into what happens later in life. But I have no regrets. It's been an amazing experience so far.
Well, thanks again for coming in and sharing your story. Can you talk a little bit about this app? I think it's the Lauren app that's designed to help pregnant and postpartum women manage hypertension and take control of their healthcare experience. Tell us a little bit about that.
Absolutely. One of the things that I recognize is there's a lot of opportunities to improve inequities. You can look at access, you can look at a number of things. But the concern that I had was the disconnection between what happens in the clinic, in the hospital, and what happens at home. Mm-hmm. And being an insider of healthcare, I recognize those worlds don't always connect even with our data.
Yep.
In fact, statistically, only 10 to 20% of disparities can be addressed in the room with the doctor that are directly linked to medical care. 80% happens outside of the walls. A lot of it links to your social determinants of health. In fact, people often say your social determinants are more impactful than your genetic code. So there's more data on this. There's more research, and hospitals are trying to figure this out. So we decided to launch Lauren as a care navigator to help women manage their care outside of the walls of the clinic and help to kind of connect those dots. So we capture clinical biometric data, right? Like blood pressure, understanding your cholesterol, basic things. We ask about stress, but we also ask about some social dynamics, things that would impact your outcomes that may not be something that your care team is aware of or have an influence on. And we want to create that more clear 360-degree view of what you're dealing with day to day, so that before you show up to the ER or the urgent care, your care team is alerted and is aware of patterns and things happening with you outside of the walls of the clinic. So,
And that data gets put into the app by the patient?
yes,
Okay.
it's patient-provided data. Okay. And right now we're building it to have an integration with a Bluetooth-enabled cuff,
Like
right?
a wearable? Yeah,
a wearable, right. And we'll have the ability to do that.
Yeah.
We're not building a wearable, but we're creating some pretty exciting partnerships. And we're designing that into the technology. So it's lower cost for us. And we're more agile with what makes the most sense for the
Yeah, that
consumer.
does make sense. Yeah.
So so that's patient provided, but it does two things. The patient is more aware of what's happening in their body. We need them to be a partner in their own care, right? There's this whole rise of the consumer health voice. But if you give them the tools, other than Google, I like Google, but other than Google, if you give them the right tools, they can be their greatest advocate. So you have to do that part, and then you have to connect and bridge that patient-provider relationship as well.
The other entrepreneurs in healthcare that we've interviewed over the past talk about how they, it's like a village of people that help them get across the finish line and then keep going. And in addition to your accountant husband and, those working on the cuff, I know in your village it's the South Carolina Research Authority, we commonly refer to as the SCRA, which helps entrepreneurs like yourself with capital and mentoring and just getting going. Can you talk a little bit about how that organization has played a role? And then also, so I don't forget, can people access Lauren now and, use the app, and how would they do that?
Absolutely. Great question. I'll first say SCRA has been an incredible resource. I'm so grateful to have been introduced to them pretty early on in our journey. We are literally 12 months in existence this month. So we are a young company, but we have been moving fast and furious, if you can tell. But I was introduced to the SCRA in March of 2023 just to be aware of that they exist, which was really exciting to know that resource was right here in the state of South Carolina. And was introduced to that team, had great conversations. I was able to pitch to them to become a member company in August, and we were accepted that same day. Within 2 months in October, we received our first project development grant, which really positioned us to move at lightning speed with the development process for Lauren. And there are a few things that came out of that. One, of course, other than, of course, getting the build, but one, we were positioned to secure 2 pilot partners we'll start piloting the tool in February. And I'll get to that last question.
Okay, good.
It's the lead in, right?
Yes.
So we're partnering with Wellspring Family Medicine, which is an independent family medicine physician in Columbia.
Yes.
But we also received the yes to partner with the University of South Carolina School of Medicine Upstate, as well as our academic pilot partner. So grateful for that team with Dr. Miller, Dr. Eckelberger. They're just, all of them are just incredible physician leaders. So we have our 2 pilot partners, and we'll be starting this quarter with that. So it positioned us well as industry partners that are waiting for the validation because they're interested in partnering on some pilots as well during the summer. And I say that because with healthcare, when in the life sciences, it's really important to have validation,
Sure,
right?
it's the name of the game.
Oh
for
yeah,
sure.
you have to validate. We have to validate our risk stratification algorithm that's in the tool. We plan to incorporate some AI as well within the platform, and we need to get feedback from the users. So we've gotten a lot of data, a lot of research, but we want people to actively use it, start collecting the data, massage what we need to massage, and iterate. And we'll be ready for go live later this year, so people will be able to access it.
Wow, that's exciting.
Absolutely.
And, in less than 24 months,
Yeah.
you go live.
It's moving fast.
Yeah, it is.
Yeah.
Can you talk a little bit about some future goals and plans for Health Evolved Technologies, and do they involve expanding some of the services under the Lauren app, or what directions are you headed?
Absolutely. I have a full strategic plan, and it's so funny. I have 7 advisors, one of which is actually an AI expert with Microsoft. And initially, my maps and drawings were very, very complex. This is last winter, and she said, "Okay, that sounds great, Kim, but let's scale that down.
Simplify.
Let's
Yes.
simplify
Yes.
it and think about what is the one thing that's important for you." And originally, we were not going to just start with maternal health, but we decided to start with the maternal health period, pregnancy and postpartum, because it's such a critical transition time for women. Your biology changes, so much happens. Our goal really is to expand and look at from the process from pregnancy to healthy aging, because we'll soon have, once we launch, have enough data to really look at predictive analytics, clinical predictive modeling, being able to identify earlier needs for cardiovascular intervention before you get to that urgent state in a way that's low cost, based on just data science. So we see that as our future. We're not a diagnostic tool today, but I have my eyes set on being a SAMD as well. So that will really position us in the life sciences space as a go-to tool that can support of course, the health consumer and the providers. And then when we think about our go-to-market strategy, our goal really is to play in 2 sandboxes. We want to partner with our hospitals and payers, but we also have had a lot of interest from non-traditional players like pharmaceutical companies that are in the primary care space, employer-sponsor health plans that are really trying to provide more value to their, women's health plans and solutions. So we're seeing an opportunity to definitely create this validated tool as it is today, but as we prepare to go to market later this year, we'll definitely have some more of those features and be positioned to really play in those 2 sandboxes.
And you're talking to the payers too, who have
Yes.
obviously a vested interest in improving women's health during these times.
Absolutely.
Yeah.
Absolutely.
Right. Good.
Well, I want to talk a little bit about some chilling facts,
Yes.
which I know motivates you. In the U.S., Black women have consistently had, I'm going to get this right, the highest maternal mortality rates, the highest in May of last year, so not even a year ago. USA Facts published the rate was over 2.5 times higher than that of white and Hispanic women, which is shocking to me, but that's the case. Your website mentions that your primary goal is health equity. Let's
Yes.
talk about that and how your efforts could maybe close that gap.
Absolutely. It's interesting. I've been on this journey, I guess, behind the scenes for about a decade, which I missed that part. After we lost Lauren, I served in a volunteer role for the Preeclampsia Foundation. I ended up serving as the board chair. And right before COVID hit, we launched a health disparities task force specifically to address that, right? And this is all my volunteer world. And we pulled in experts from across the country representing Morehouse and Howard and Harvard and others. And we talked about this. We talked about the stats. We talked about the stats that existed 12 years ago and how they were horrible. And, one of the things that I desire to do with our company is to use the data, use the social determinants of health data to help care teams stratified based off of health equity. So I'll give you a very simple example. One of the things that we learned. If you think about rural South Carolina, we were kind of chatting before we got started, and the fact that we have mainly a rural state. We have more maternal care deserts, right? Here now in the state of South Carolina and Mississippi and others, and Georgia, of course. If you know that you're at risk for hypertension, one of the goals is, of course, low sodium diet, healthy eating, but you don't have direct access to healthy foods, it's hard to achieve your health goals. And when I say direct access, if you don't have a grocery store within a certain mile radius and you're having to utilize a convenience store, which mainly has high sodium foods, for your dinner, for how you access meals, and maybe it's lower cost, that's problematic with really addressing some challenges. So you may have more challenges. Ultimately, you may have develop heart disease or cardiovascular challenges even when you're done having children. And we want to create a way, without giving too much away, we want to be able to create a way to identify the clinical connection, the clinical outcomes of patients and their social issues, right? The social gaps that we have. And how can we be creative with some public-private partnerships to close the gap? I tell people that, and I'm really passionate about rural health just because, my journey experience with Lauren started when I was in a rural community before I came back to the Midlands and was at the hospital. If I had waited around a few hours, I don't know if I will be in front of you today, just being honest. So I'm really concerned about seeing ways to couple our technology with partners that can help us close the gap together. Those partners may be pharmaceutical companies, Those partners also may be mobile food trucks that we're seeing more of in certain states like Georgia and Virginia that may go into rural areas where we can use our revenue to fund public health initiatives within the markets that we want to have an impact. So we have a true, I will say, social impact mission that's embedded in what we're doing. It's going to impact how we launch and provide those resources really at no cost to consumers. And if we collect enough data that captures their clinical condition as well as their social condition, we'll have a better picture on how we can close the health equity gaps, being strategic. For sure.
That would be legacy building.
Yeah.
It is. Mm-hmm. It is legacy building. I'm really big on this. It's interesting. Entrepreneurship is not easy. You're building.
It's not for the weak of heart.
No.
It's a journey.
You're building something that it has to be meaningful. So if I'm gonna, leave the C-suite for this, then I want it to be meaningful and something that my children will be proud of, and something that, my future daughter-in-laws won't have to worry about as much, right? So,
well, you've mentioned being a patient being their best advocate, which I agree is something that's needed. And you mentioned the rise of consumerism. And with that, we've seen patients get more information about their health care, the delivery of health care and the services they're consuming through technology and additional education. But what's the best way as we become more educated consumers about healthcare for patients to develop a comfort level in asking questions about their care and being their own best advocate? Because that's not always been easy for patients to ask questions of doctors and other providers about the care that's being delivered to them.
Absolutely. It's so interesting because sometimes it's cultural. Mm-hmm. It's cultural in terms of that level, making sure you have that level of respect in the room and not wanting to offend, especially if we think about the U.S. being truly the melting pot. We have a lot of cultures across our country. And even as I had conversations with people in this space, maternal health space in other countries, they talked about the same issue, the lack of willingness to ask questions. This is coming from areas like Ghana and Kenya, this desire to respect authority. And then there's some people that truly are intimidated, right? I mean, there's white coat syndrome is a thing. It's real. And I would say one of the things that is foundational to all of this is establishing trust. And I would say that is the one area that when we think about having a culture of health equity, that's a great opportunity for healthcare teams, healthcare organizations to help to facilitate, right? There's so much distrust. And sometimes it's because there's a lot of misinformation out there. That's a whole another
Particularly now,
conversation. There's too much misinformation and there's a lot of fear, right? You don't want people to be equipped with information and it leads them to having fear. And what addresses fear, what kind of addresses that and pushes it aside is establishing trust. I'll give you a very simple example, a personal example. I, had a test, and this years ago, we changed the law that required lab results to come straight to the patients, right, immediately. So you didn't wait for the physician to put it in an envelope and mail you the results if you had an abnormal lab test or what have you. With our EHRs, we're saying, okay, you need to have access immediately. But what happens when you get an alert on your app and you get your result and it says something you're concerned about, but the doctor hasn't even read it yet and it's 10 o'clock at night.
Yeah.
That literally
happens all the time.
It happens all the time.
Yeah.
It just happened to me. I had questions. Thankfully, it worked out. It's no issue. But my level of comfort in asking questions with the nurse and their responsiveness, and they called me and said, I know you have questions because of what this said. Right. Know that you don't have to worry. So it's that level of comfort that it just calms you. Because, and what do you do when you get any information that might be concerning, right? Do you have someone to lean on? Now, if the only people you have to lean on are other non-healthcare providers that are just consumers that don't have an understanding of it, it can really create a level of distrust and separation. I think with anything that we do with providing the data, we have to do it in a way where it fosters that unity between health consumers and the care teams. And when I say care teams, I'm not just talking about physicians. It includes maybe their doulas, the midwife, a therapist, a loved one that's their caregiver, right, on their journey. So whoever's in your village, to make sure that you have that level of trust so that when you do get information that is accurate, right, that you have someone that you're comfortable enough to have a conversation with. And I think our healthcare organizations can help facilitate that.
And the providers, I think, hopefully are getting additional training to establishing that trust, anticipating some of the questions, concerns, tension levels, and addressing it that way. So they're a little more open to, follow-up questions.
Absolutely.
Hopefully that's happening.
Well, it is. I would say in most health organizations that have employed physicians, there are required modules and trainings, and it's always important. And I'm a healthcare person, right? So I'm gonna be sometimes the devil's advocate. It's always important that we don't check the box, though, right? Oh, yeah. Any organization that has the complete 40 or 50 modules a year, you just want to get it done.
That's the EMR model,
right? That's the model.
The box.
But it's important that you have the ability to test the learning, right? And ask questions and create that space to do that. So if you're creating a culture where it's a learning environment and you're able to test the learning, and there's we have culture of safety, right? There's a level of safety and trust, even amongst providers, colleagues, to address a concern, to talk about a situation, engaging with the patient and family where I maybe could have said this differently or try this approach. This seems to work better. As long as that collegial those conversations are having, I think we're on the right track.
That's good.
Well, Kim, you've got a good work. You've done a good work so far in a year with Health Evolved Technologies, and it's exciting to know where you're going. I hope you'll consider coming back on and telling us how, especially after the Lauren app launches, telling us how things go. But we thank you for taking your tragedy and turning it into good for, what could be countless people across the U.S. and beyond even.
Absolutely. Thank you so much for having me. This is, if you can't tell, this is a joy to talk about, something I'm passionate about. So I would love to be back.
Good. Well, it does flow very easily from you. On behalf of Matthew and everybody here at Taking the Pulse, we hope you enjoyed today's conversation on one person's entrepreneurial spirit to close the gap in healthcare equity. And we look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.